Hello, good morning.
At 73 years old, Bernard Francis has finally decided to get tested for type 2 diabetes, which is usually related to lifestyle. If you're black or Asian, you're far more likely to develop the disease.
This is a copy for you to take home. I wrote down your sugar level here, 5.4.
The diabetes awareness bus was just one of several services on offer at a health fair in Leicester this week. It's not just diabetes that's more prevalent in black and Asian communities. So is sickle cell disease and prostate cancer and mental health problems. And the organiser of this event says people aren't getting the help they need.
What organisations need to do, and the powers that be, is to target so they know where the gaps are, they know who are not accessing services until they're at crisis point. It's about target those groups, target them and ensure that we're addressing their needs at that early stage before they get to crisis point.
Leicester is the only place in the country to have a centre for black and ethnic minority health. It's found that the stigma attached to issues like mental health can be far stronger in these communities.
It's about privacy and it's about maintaining personal dignity and the confidentiality. If you're suffering from ill health, including mental health, there is a tendency to want to be insular about keeping that confidential.
Sherelle Agostin has found even when you do seek professional help, the response can be patchy. She has sickle cell disease. It's the most common genetic disorder in the UK, and most people who have it are either from African, Caribbean or Asian backgrounds.
Sometimes the services, the specialist services, are getting closed down, which means there's more pressure on general services, and we find that doctors don't necessarily know how to treat sickle cell. And it's something that I'm really passionate and scared about actually for the future of children growing up with sickle cell.
Closing specialised services is a false economy, according to community health campaigners. They say invest in raising awareness now and you'll save money in the long term. Back to Bernard Francis.
They say I got to cut out a lot of the sweet stuff and things like that, and I love sweets. So that's going to be my hardest bit, but I can start doing some walking and exercise.
The good news is he's not got diabetes. The bad news is he's got to lose weight.
Do you know what carbs are, where you will find your